On Friday, September 4th, there'll be thousands of dollars to be won. A lotto jackpot of $75,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $75,000.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
The Super 6 jackpot for Friday, September 4th is $200,000. Super 6, more jackpot money.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Tonight on the VC3 News Update, SVG's cabinet approves first cannabis dispensing license. A call for persons to cooperate in the national response to the novel coronavirus has been made by the Chief Medical Officer, Dr. Simone Keyser Beach. Speaking on NBC Radio this morning, Prime Minister Gonsalves said that one of the major changes to the COVID-19 protocols is that Jamaica and Trinidad and Tobago have been placed in the grouping of high-risk countries. Prime Minister the Honorable Ralph Gonsalves says that schools reopening on Monday, September 7th, and masks will be available for teachers, children, and security personnel.
And in your local sports, in the Premier Division of the SVGFF National Club Championships, Awesome FC ensured that they will remain in the Premier Division when they stopped defending champions Besco Pastures 2-1. And this evening, the already crowned 2019-2020 champions, Hope International, will meet SV United in the first match of a doubleheader at the Victoria Park.
We'll have these stories and more at 7 p.m. this evening on the VC3 News Update.
Good evening and welcome to today's edition of Roundtable Talk. With me at the Roundtable this evening, Dr. Jerrol Thompson. He's not here to talk so much about COVID this time. The topic is actually dengue, and of course he's an infectious diseases specialist. We also have epidemiologist Tamara, Bobb. And of course, our lovely Shanika is back with us. She's the Health Promotions Officer in the Ministry of Health. Welcome back. Dengue is all the talk. Apparently, there has been quite an increase in the cases here in St. Vincent and the Grenadines, said to be quite unusual. Tell me, give us an update. What exactly is happening where that's concerned?
Good evening, everyone. So, just to give a little background, the last major outbreak of dengue in the region was actually in 2009. And for St. Vincent in 2010 and 2014, we had outbreaks where the cases were about 240, thereabouts. Now, CAFA predicted that there would be an outbreak. That was around 2018. In the region. Now in 2019, we had countries like Jamaica and Dominica having their outbreak. And now in 2020, we started to see an increase in the number of cases here in St. Vincent and the Grenadines. So as of today, we have 184 laboratory confirmed cases in St. Vincent and the Grenadines. Our last update was on the 25th of August, where we had just about 74 cases. So we see that over the last week or so, we've had quite a significant increase in the number of laboratory confirmed cases.
Doc, tell us, what is dengue fever exactly?
Well, dengue is a virus. And, you know, there are a group of viruses that are transmitted by the mosquito. And we call them the arboviruses. And dengue falls into a group of viruses similar to that of yellow fever, similar to that of chikungunya, similar to that of Zika to some degree. And there are a host of other viruses. And the mosquito, and if I could give you a little idea of the big culprit, this bad boy, the Aedes aegypti, it basically uses our blood to help in its whole reproduction and feeding and so forth. And to do that, and to pierce our skin, it has to inject some saliva. And believe it or not, these viruses, the dengue virus, these other viruses, somewhat live somewhere in that salivary gland, and by injecting to draw blood, they inadvertently infect us. And when the virus gets into us, it can cause a number of things. And let me use this prop to help. There are about 3 things it can do. It can cause a simple, we call dengue fever. And the vast majority of persons will have dengue fever that is mild, or it may be moderate or severe.
So there are 3 different levels.
Well, let's call dengue fever in a range of things. It could be mild and as a spectrum to severe. But the most severe cases is not DF, dengue fever. We call dengue hemorrhagic fever. And then there's also another one, which is even more severe, called, as you see down here, dengue shock syndrome. Now, these conditions are what people are likely to experience. And let me just tell you, what it's all about is persons tend to get a high temperature. Fever is characteristic. Sometimes there's nausea, vomiting, there's pain in your joints. There can be pain in your eyes, but it's in the back of the eyes. You get pain in the back of the eyes. There can be a rash, and there can be a host of other symptoms. And what then happens is with this high temperature, people can become a little dehydrated. And as a result, you could go into a small amount of persons, 1% or so. The severe cases could develop a more severe, the dengue hemorrhagic fever. This is where the infection starts to affect your blood. And the substances in your blood that help to allow you to clot properly, form scabs, those decrease. We call them platelets. And when they fall, you can start to have bleeding. Bleeding from your nose, bleeding from your mouth, bleeding from other parts of your body. Now, if it gets very severe, you can have some severe problems, And then there is the dengue shock syndrome, whereby, believe it or not, your blood pressure can drop. Sometimes if we take your blood pressure, we can't even detect your blood pressure. You understand? And there's swelling, there's all sorts of things that take place. It's very difficult to describe the condition, but everybody can react in a slightly different way. But we want persons to know that there's dengue fever, which could be mild to severe, and we want to make sure they don't shift over into dengue hemorrhagic fever.
What will cause that to happen?
Well, it depends sometimes, and I should have said that there are different strains of the virus, 4 different strains. I believe here in St. Vincent, we're not sure which one, but in St. Lucia, we know they've found their type 2 and type 3. So type 1, 2, or 3, or 4. And this type 2 or 3 seems to be affecting the region right now. We're about to confirm which one it is, or if it's more than one. But there are lots of factors that can determine whether you become more severe or not. Believe it or not, diabetics, persons who are debilitated, sometimes even younger persons, And we have to look at a lot of these factors. And I think that the folks in the hospital are doing a marvelous job because they've been admitting persons whenever they've shown any signs. The high fever, and that fever can be sometimes 106 degrees, you know? So there are lots of things, and these things will come out as we go on with the program.
Okay, so the important thing to note is that this is caused by the Aedes aegypti mosquito.
Yes, it's a virus that is using the Aedes aegypti mosquito as a vector, we call it. You know? That's the vehicle, that's the car, that's the bus that's carrying this crook to us. And the virus is able to infect us through the activities of the virus, biting us and breathing and so forth, and all the other factors that go along with that.
Is anybody more susceptible than the other at
Well, do you know, if you have caught one strain of the dengue virus in the past, you are immune to that strain, but you can catch another strain. But the individuals who are exposed to these other strains are a little bit more susceptible. We've also found that having other viruses in the past, Zika and other things like that, can increase your risk of a little bit more severity. But there are lots of factors that contribute to that, and so those risk factors would come out.
Okay. What's the difference between being infected with chikungunya as opposed to dengue fever? Is there a huge difference?
Chikungunya is a different type of virus, a milder virus. It can give you a rash, could give you a little fever, and the more severe cases may give you joint pains and so on. It typically doesn't give you this hemorrhagic problem. Zika, on the other hand, is a virus that gives you a similar sort of thing, but we worry about pregnancy. Persons who are pregnant, the virus can affect the development of
The fetus?
the baby in the womb and make the head come out of the baby come out very small if the mother catches it. But dengue can be a killer. Dengue can be a serious concern, and I will tell you, over 50 to 100 million cases of dengue reported every year around the world. And there are over 500,000 people who get very severe, the severe hemorrhagic cases, and a certain percentage of these who die around the world. Southeast Asia, certain parts of Africa, it's very severe. In South America, Brazil, St. Vincent, we're still within the zone, but and we haven't really had severe outbreaks. I hope that this is one that we could get on the control. Because if it gets loose, and around this time of COVID and the comorbidity with COVID, we certainly want to make sure dengue does not get out of control and so forth.
So how severe have the cases that you have noticed here been so far on a scale of 1 to 10?
Well, I won't use a scale, but to date we have had about 62% of all cases reported being hospitalized. In terms of persons with dengue hemorrhagic, we have just recorded about one or two cases. So I would say the majority have been mostly mild.
Mostly mild. Have there been any deaths so far?
Not that we've recorded so far.
Not in St. Vincent so far? Okay, when we come back, we'll talk about having to manage dengue now in the season of COVID and in the hurricane season as well. You guys are on the health subcommittee, so you probably have quite a bit of a challenge doing that. So we'll talk more about that and some of the things that we can do to prevent us from getting dengue fever. Back in just a moment.
On Friday, September 4th, there'll be thousands of dollars to be won. A lotto jackpot of $75,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next Lotto jackpot, $75,000.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
The Super 6 jackpot for Friday, September 4th is $200,000. Super 6, more jackpot money.
More jackpot money, more reasons to play this game. More money for way. Super 6 a bigger jackpot game.
Welcome back. Tamara, let's look at the age group of those who have been affected so far. What kind of ratio do you have?
Okay, so to date we've noted quite a few infections in children. The age group 0, because we have as young as 1 month old. From 0 to 15 years old, we have about 45% of the cases are in that particular age group. All right, and we know with COVID-19 pandemic, schools have been closed for an extended period of time. We've been encouraging persons to stay at home. But the thing is, the mosquito loves to be around the home. It loves to be wherever there's fresh water. So our children are at home, but they are at risk now because they are around the mosquito for longer periods of time. So there's more opportunity for them to get bitten.
Okay, children more susceptible, Doc?
Yes, absolutely. Well, I'm really glad that the kids are going back to school. I'm glad that they're going to be getting their temperature taken and so forth, because that's the way in which we are going to pick this up in early cases. The mosquito bites during the daytime. It bites around the knees, the ankles, around the ears, and around the neck. And I'm sure, you know, we're going to hear about how do you protect. I've come here in my long sleeve shirt as opposed to a short sleeve shirt. That's the thing. I haven't come in a pair of shorts. I've got my long pants on. All those other things. The thing is that this is different from COVID, where being present to somebody, you could pass it on to. It's a mosquito that's doing that job. And that's the whole thing. How do you prevent the mosquito from affecting you? And how do you get rid of it in your environment? That's the big thing. There's some other things we look at. But I am convinced that because kids may not have been exposed before to previous outbreaks of dengue. So I haven't checked my antibodies, but I'm pretty sure I saw my first dengue case, somebody traveling in New York, in the 90s. And I've been to various parts of Africa where there's dengue. So I might have been exposed to dengue and picked it up mild. That means that I might have been protected to type 1, maybe type 2, maybe type 3. But a lot of people are not. But the kids, young kids, would not have been exposed to the virus before. And so they're definitely susceptible. They won't have any antibodies. They won't have any immunity protection for this. And they're running around the place and so forth. And, the short pants, the short, shirts and so forth. And I think that they're greater risk in some regards, and they have to be protected in a much more intensive way.
What are some of the things that the ministry is doing to combat this illness?
All right, so far what we have been doing, specifically the vector control units have been doing their fogging. It has been done across St. Vincent and the Grenadines.
Last week into this week, they have been focusing on schools across St. Vincent and the Grenadines as it concerns to the reopening of school. But a lot of the messages that we are pushing right now for the preventative aspect is that we want persons to pay attention to their immediate surrounding. Within a community, if each individual, if each household can pay attention to what is around them, that could also help. So we want persons to look for any sort of container, any sort of tire, anything that can keep water that is out of your control. We want you to tip it, which is to tip it over, empty it out with the water, and then if you don't need it, toss it out for your next garbage collection period. And if we continue to do that more on an individual level, then it would have some effect in the general community setting. We encourage a lot of homeowners to also have a conversation with their neighbors. If you have neighbors who are not compliant, to see how best you can assist in that area as well. Wearing of the long sleeve, as Doctor would have mentioned, especially if you're going into an area. I know we would have put out a press release a couple weeks ago indicating that there are specific areas that have been affected more than others. If you're going into those areas, we ask you to wear a repellent, wear long sleeve clothing, etc., so that you can avoid being bitten by the mosquito that would be the vehicle for the virus. We have been also doing a lot of our social media posting. We have a lot of things in the pipeline to partner with a lot of stakeholders so that we could continue to get the message out there to the public.
Okay, I'm told that we have a question, but I can't see the question from where I am, so I don't know what the question is. Remind us again of the areas, the specific areas that the majority of cases are said to have been reported as coming from.
So the majority of cases are in the Pembroke Health District, and this is from Camden Park to Barreley. So that's where we see the majority of cases. But there are cases all over, but just to a lesser extent. We also have in the Southern Grenadines a few cases there as well. But the majority are in the Pembroke Health District. If we want to zoom in, we have communities like Vermont and Penistone.
Okay, and Barley, I think, is also...
Right, that's a part of the district as well.
Okay, all right. What do you think is the reason for...
people speculate. Vermont is a very wet area and so forth. But the people of the area and the people all over St. Vincent and the Grenadines have to do what is being said. Tip and toss. Tip and toss. Tip over those tires. Look for even small sausage cans, plastic bottles. Well, I'm glad that we're now recycling those plastic bottles. Those are notorious for collecting those things. The mosquito loves cleanish kind of water, right? Even waterlogged areas that don't drain properly. And so it loves that, and within a couple of days it could become infected. If I'm infected and I'm having a high fever, during this phase of high fever, a mosquito bites, it's able to pick up the virus from me. And the mosquito, it doesn't get its fill from one person. It loves to do multiple bites. So it'll jump at you. You understand? Then we go to the next room, go to the next house and bite them too, get a little bit of blood from them, and get another little blood from somebody else. And by injecting the saliva into them to allow the blood to flow properly, the saliva kind of makes the blood flow easier into the thing. And the mosquito, this is a mosquito with the blood inside it. This is well fed. This is a mosquito that's well fed. And the point I'm making is
so that's its food, actually.
Well, yes, and it uses that to help to make in its reproductive system, to nourish its eggs and all that kind of thing. You know what I mean? It's a complex process, but the point, it's feeding on multiple people in a given feeding cycle. And if it is picking blood up from me who's infected, say I'm the third person it's feeding, I'm the one who's infected. It's going to pick it up from me, and the fourth person could then get infected, and the fifth person then get infected. And then if I now leave and I go down to Chateaubriand and I sleep off in Chateaubriand, and a mosquito comes and bites me again, and goes and feeds the next one next door, and next person next door, and next person next door, then they could get infected. Some of them very mild, but as we're seeing, 1 out of every 100 could become very severe with this dengue hemorrhagic fever or the dengue shock syndrome. Those are the severe cases.
And I should add that to break that transmission from person to person, then we encourage persons who are infected to use the insect repellent and to sleep under mosquito nets. So if you know you're infected, you got your diagnosis, then you should wear repellent and sleep under the net until you have recovered.
Okay, sounds like a good idea to me, because some people wonder how so many people in the same household can become infected, and you have just clearly explained how that is quite possible.
Yeah.
When should I see a doctor?
You should see a doctor, and the doctor may consider hospitalization. I'm going to answer those two questions at once. If you're having a fever and it's unusual, temperature is getting very high, your child, the temperature is getting very high, you don't want a child's temperature to go to 106. It will start to cause serious problems with the brain, could cause them to have seizures. That temperature must stay down with any kind of viral illness. This virus also can cause nausea and vomiting. And there are things to stop the vomiting, but we tend to hospitalize person if they can't stop the vomiting, because we know they're going to get dehydrated. They could have abdominal pain. I was telling you about this strange eye pain behind the eyes. And anytime there's any bleeding, now, if I were to get hit in the nose, punch in the nose, my nose might bleed. But if I just start bleeding and I got a fever and I'm feeling weak and fatigued and muscle aches, and it may be likely dengue, and I should see a doctor, and they may recommend hospitalization if it's looking that this may be one of those cases that's going towards the dengue hemorrhagic fever or the dengue shock syndrome. They take your blood pressure, and your blood pressure is coming down, and you ain't look as if you could really take proper care of yourself. If you're vomiting and just everything's just coming up, and even you drink a little water that's coming back up, we could tend to hospitalize you in those kind of cases. And especially if the person is young, a young child, and so we don't take any chances, because by sending them home, you know, the mother may not have a thermometer, they may not have all these other things, and they may not have the means of really taking care of the child. So we keep them in hospital for a few days.
Okay, when we come back, we want to talk a little bit about treatment, if there are any specific treatments, and talk some more about some of the demonstrations that we have on hand here. Back in just a moment.
Tonight on the VC3 News Update, SVG's cabinet approves first cannabis dispensing license. A call for persons to cooperate in the national response to the novel coronavirus has been made by the Chief Medical Officer, Dr. Simone Keiser Beach. Speaking on NBC Radio this morning, Prime Minister Gonsalves said that one of the major changes to the COVID-19 protocols is that Jamaica and Trinidad and Tobago have been placed in the grouping of high-risk countries. Prime Minister the Honorable Ralph Gonsalves says that schools reopening on Monday, September 7th, and masks will be available for teachers, children, and security personnel.
And in your local sports, in the Premier Division of the SVGFF National Club Championships, Awesome FC ensured that they will remain in the Premier Division when they stopped defending champions Besco Pastures 2-1. And this evening, the already crowned 2019-2020 champions Hope International will meet SV United in the first match of a doubleheader at the Victoria Park.
We'll have these stories and more at 7 p.m. this evening on the VC3 News Update.
Welcome back. Just before the break, we wanted to explore the whole question of what are the treatments that are available to treat with dengue.
Well, one of the things we know is that fever is something you got to keep down, and we are recommending just Panadol, paracetamol, anything of that nature. We call those drugs acetaminophen. We should not use aspirin. We should not use ibuprofen or Voltaren or those other things, because they could cause some severe complications anytime there's any type of virus. And especially in kids, there's a condition called Rise syndrome. We don't use aspirin. We want to tell parents and so only use the Panadol, paracetamol and so forth. And that's usually, the usual thing is fluids, if they can take it, and making sure that they are well hydrated, and if necessary, hospitalization. But I want to bring up something. Coming out of India, they have discovered that papaya leaves, what we call steep with a little hot water to extract a substance inside it, works. Now, it doesn't so much work for the mild cases or necessary. It works for some of the more severe cases. Now, this has been studied, and they've found that there is some benefits. And in a world where there's a lot of fake news, right, you would not imagine that alternative therapies, people come up with all sorts of fake therapies. But I am actually quite surprised that not only for chikungunya, but for dengue, that the papaya leaves, not boiled, but what we call steeped in hot water and drawn and so forth, actually works. You take about 2 doses per day. It tastes a little bitter, a little sugar inside it and so forth will help. And that usually, I want to make sure I'm not advocating that everybody should just start to drink papaya leaf juice now. That'd be malpractice if I were to say so. But I do want to say, since you've asked the question, that we've found that there are some benefits, certainly. And what it does, it stabilizes the blood cell, the platelets, and it helps to increase back up the white blood cell, which is also dropping, and helps to some degree to stop moving over to the hemorrhagic fever portion, the severe portion of it. So if there's a mild case and so forth, no pain, there's no need to do anything like that. But the main thing I want to say, see your doctor first. Deal with a healthcare professional. And I'm only offering this because I'm looking to give some credence to the research that's been done on papaya leaf, so that persons don't think that it is something out of the way. There's some real potential benefits as a result of it. And I want to say, in the past, in the case of chikungunya, I used it too.
I did as well,
yes,
and it worked.
Yes. Well, I must admit to the listeners that I used it, right? So.
Okay, how long would someone take to recover from this
boy,
illness?
I tell you, persons recover. It's a matter of several weeks. But there are, and I think you had a question on that, there are some long-term effects. The strange illness is it could cause hair loss. it's one of the causes of what we call chronic fatigue syndrome. And persons could go on for many months and years with chronic fatigue. There are certain type of deficiencies that are induced, certain vitamin deficiencies, we are not sure why. Vitamin B12, vitamin D, vitamin nothing, that this dengue virus tends to cause. And there are a number of persons who can develop certain aspects of anxiety and depression over a longer period of time. These things are being researched and we don't quite understand. But I know that there was a question, can there be any long-term kind of sequelae or long-term effect? These are just some, and in every different society there can be. So I wanted just to show this out, as being some of the strange manifestations of dengue in a very, very small percentage of those persons who get this disease.
But who is likely to suffer from these kind of long-term effects? Is there a particular portrait of a patient that...
not really. We're all very different. And as I said, there are 4 different strains. And you get the first one, by the time you get the second one, the second strain, like if you're exposed to the same strain that you got first, you're all right. You're immune to that. But if you're exposed to the second or the third or fourth variety, you can develop a more severe type of illness. And dengue is a real strange disease. As I said, millions of people around the world, it's in the tropics, and sadly there hasn't been sufficient research. Now it's moving up into the United States, Florida, and certain parts of Europe, but it's not a temperate country type illness. And so as a result, we really need a lot more work being done on dengue to see how we can talk about this, both its elimination and its treatment. But because it's a virus, there is no definitive treatment for viruses. We don't have good antiviral treatment. They're working on a vaccine, but because there are 4 strains, it's very difficult to really get this going. But I think we're quite hopeful that there are going to be a number of things coming out in this regard.
How many times can someone contract the disease?
Well, you can contract it 4 times. 4 times. With one strain, you can get it, recover. A year later, 2 years later, you get the other one. A couple of years later, you get the other one. And sometimes you might be able to pick up both of them at the same time if you're so unlucky. So we just have to watch all these sort of things and see.
And that's why it's important for us to know how many different types are circulating right now during the outbreak. So as Dr. Thompson would have mentioned, we've reached out to the Caribbean Public Health Agency to do that typing for us, and they're supposed to feedback that information to us soon. So we'll know exactly what types are circulating right now.
Okay, and St. Lucia, you mentioned...
They have types 2 and 3.
2 and 3.
Mm-hmm.
Okay.
And because people tend to recover for the first strain, it will be very mild. So I've seen a lot of comments on Facebook. A lot of people will talk and say, oh, you just get dengue, take the paracetamol and then you're good to go and then you move on. But we're actually trying to have more, because even WHO indicated that even if there is a vaccine, the preventative measures will still have to go hand in hand, because as Dr. Thompson would have mentioned, the vector would still be around to carry the virus from person to person. So right now we're actually advocating for persons to have this home care kit, and it's in preparation, preventing them from getting dengue, and it can also be used in the event that they have a case, a laboratory confirmed case within the home. So first we ask persons to get a mosquito net. There are the ones that are treated, and then there are the other plain ones. We encourage persons, especially those persons in the vulnerable group, children, as we see our data is showing, elderly persons, those persons with pre-existing conditions as well. We're also asking persons to get repellents.
So this is your mosquito net?
Yes.
Yeah.
So the net is important because you can use that over your bed if you have a crib where a child is sleeping, etc. Especially preferably very early throughout the day if they're sleeping throughout the day into the evening as well, because that's when the mosquito is most active. We encourage persons to get a repellent. The repellent will actually just work to sort of deter the mosquito from wherever you are. So I've said to my friends, if you pass me or smell me and I smell like citronella, it's just a precautionary measure. But get a repellent. On our Facebook, SVG Health, we have posted the active ingredients that are needed to be in your repellent for it to be effective. So persons can go there and look at it. Dr. Jerrol can probably talk about some of them. The words are very long, but we encourage you to get a repellent.
This is a repellent?
Yes, this is citronella. It's like a Vaseline.
Right.
So you just take it and you can apply it to your skin. And this is one that you can just use to spray. So you can just spray your skin, and then you can use it. As Dr. Thompson would have mentioned, you want to spray the areas that are most likely to be bitten. So around this area, around here that is exposed, and around the ankle area as well. I have used this one, citronella particularly. I haven't had any sort of flare-up, but we ask persons to be mindful. Monitor yourself, and if you see that you're developing any sort of reaction, etc., then you can change, alternate. Persons are more gravitating towards a natural way, and all we ask is to make sure that it has the active ingredients to give you that added protection as well.
What was the natural way?
Some persons are using like the lemongrass and fever grass and mixing certain things to spray, etc. I know some persons are asking local persons to make like candles and different things. So as long as it has the active ingredient and it gives you that protection, we're fine. As it relates to dehydration, especially in children, we're asking parents to pay very close attention. If you are at home and you suspect that your child may be a bit dehydrated, there's a solution that you can mix. It's a simple solution: 6 teaspoons of sugar, half teaspoon of salt in boiled water, and it's just about 1 liter. I brought this bottle just to show. And you can allow the child to drink this amount. You can put it to chill. The child can drink it for that specific day. We ask that you don't let the child, so it don't go over. So if this is for today and you have some left over, the next day you do a fresh batch. And that you can use at home for home care, unless you are advised to take the child to the hospital where the child may need to be hospitalized.
Okay, so that's it. I see it in the thermometer. I guess when we come back, you'll tell us about the use of the thermometer.
Yes.
Okay.
Yes.
We'll be back for a final break in just a moment.
And 114. Visitry. Channel 114.
Tonight on the VC3 News Update, SVG's cabinet approves first cannabis dispensing license. A call for persons to cooperate in the national response to the novel coronavirus has been made by the Chief Medical Officer, Dr. Simone Kiza Beach. Speaking on NBC Radio this morning, Prime Minister Gansav said that one of the major changes to the COVID-19 protocols is that Jamaica and Trinidad and Tobago have been placed in the grouping of high-risk countries. Prime Minister the Honorable Ralph Gonsalves says that schools reopening on Monday, September 7th, and masks will be available for teachers, children, and security personnel.
And in your local sports, in the Premier Division of the SVGFF National Club Championships, Awesome FC ensured that they will remain in the Premier Division when they stopped defending champions Besco Pastures 2-1. And this evening, the already crowned 2019-2020 champions, Hope International, will meet SV United in the first match of a doubleheader at the Victoria Park.
We'll have these stories and more at 7 p.m. this evening on the VC3 News Update.
Welcome back. This is our final segment. There were two questions that came up earlier, but I think we did answer them in between. But specifically, someone wanted to know whether dengue fever had any long-term health implications after a person has recovered that we are aware of. And someone wants to know, is there a vaccine or any medicine for prevention of the virus? I think somewhere along the line you had responded to them, but
we don't have a vaccine yet. Remember I said hair loss, chronic fatigue syndrome. You could have conditions of arthritis. I didn't mention that before, but there's also depression. And there are a number of other things because the virus behaves a little strange sometimes. But these are some of the things we've been observing. And of course, your increased risk of getting it a little bit more severe when the next infection comes around. I want to emphasize those particular things. Some of the long-term things.
During the break, we were talking about the fact that some people seem to associate dengue with living nastily. Can you debunk that myth a little bit for us, Shanika?
I think it's important for persons to consider that almost any activity that you would do in and around your home right now that would encourage mosquitoes to breed could potentially be a hazard to you and the rest of your family. If we look at, this is the summer, a lot of persons have been doing activities for their children, more outdoor, blowing up pools, having the water toys, etc. All of these things are actually breeding site for mosquito. The pet containers that we would use to feed our pets, to put them out and they collect water. And as you mentioned earlier, we're actually in the rainy season. So from time to time, we're going to have these rain droplets that may be very spontaneous, come rain today, no rain tomorrow. These are all holding areas for the water. So we are strongly advocating and encouraging persons to at least once a week to dedicate that time to check within your household. It could be in the kitchen area, you may have a container, a vase that holds water with some fresh flowers because you like your flowers, etc. If you look at your cupboards and your closets where it's dark, they will tend to gather there more. You can put more light in those areas as well. But more so, dedicate one day per week where you actively check. For the water storage containers, for persons who still would like to store water and you have those drums, etc., we advise that you follow the advice of the public health officers when they do their inspection at your home. For most instances, persons would say, oh, my drum is covered, so what's the problem? The drum is covered, but whatever you're using to cover is tipping in the water. So that also is also a breeding area for the mosquito as well. So what we ask is that you throw a bottle or something that would separate the water from whatever you're covering it with. So
It's a little bit more technical, and the vector control officers and the public health officers have been working with the communities, but it's really important for persons to understand and to try their very best to comply. We will try to do a lot more posting on our Facebook page, on social media. We will also try to use SMS messaging by phone, etc. So we're asking persons to comply and make sure. And it's funny because at this time with dengue, we're back with the thermometers. So having, and we said it with COVID as part of your family kit, etc., that you should have a thermometer included. And we're back here with dengue with it as well. Being able to check your child's temperature, or an elderly person, a pregnant person, or even an active individual, because the research is showing that children and young people will bounce back very quickly. But that's from one strain. What we're more concerned about is when they go to a second strain and they go to more severe cases. So all of these things are important. So checking the temperature is important, that if it gets to a point where it needs to be managed within a facility, to move the child or the individual into that specific space. So I think it's important for persons to understand that it's not just associated with people who throw rubbish and have things pile up. Yes, that is contributing towards it. But the simple things that we do in and around our homes, like my mother loves her palms and flowers, but the pot, the bottom, the holder of it, she has to now make a very active effort to wash that on a weekly basis to ensure that that does not become a breeding site. While it's something that she enjoys, it could also be something that is very detrimental to the rest of her family and the wider community as well.
I've noticed that the mosquitoes like behind my bed, between the curtain and the bed. I mean, they just arrive there. So darkness,
the
also
dark area. We ask that you put some light in those areas, or try to get the light. Also, it could be the type of curtain. I know, Doctor, if you can comment on that a bit, because sometimes, depending on the curtain, they tend to hide in between there, and then they come out when it's more when it's appropriate for them to come out. And so these are all things that we want persons to consider. During the day, we ask people to wear very light clothing, long sleeve preferably, unless you're not wearing any repellent, especially for children who are going to school. And this is why specifically we've been focusing on doing the fogging within the schools, cleaning up the school compound. It's going to have to be a shared responsibility between the Ministry of Health, the institution that the child is in, the parents, and also again the teachers.
How effective is fogging?
Fogging has its effectiveness, has some limited, but it's one of the methods. You know, mosquitoes have sexes. There's a male mosquito as a female mosquito. As a female mosquito that's going to bite.
Really?
Matter of fact, one of the things we've been looking to do is to introduce male mosquitoes as sterile, so that reduces it. But we live in a zone, and we're into the rainy season, we're always going to have mosquitoes. And what I think was indicated is, how do we reduce the population? And then you can have mosquitoes, but you may not have somebody who has, the dengue in their blood. You need someone present with dengue, but now we have it. And those mosquitoes are going to bite them, and as I said, bite 3-4 other persons. One of the things is, how do we pick this up early? And what was said, taking the temperature is a good measure. It's one of the first signs. The symptoms last with 2 to 7 days, and temperatures could be a little high, moderately high, very high. We want to pick it up, and that's why the kids going back to school is going to be an important thing. One, they're out of the house where the mosquitoes are in the school. There may be some mosquitoes there, but I think there's less likely that's going to be there. That goes through a rigorous cleaning program. And this checking the temperature, we're able to pick it up very early. Now, every household should have one. But you know what? There's some bogus fake news that's going around, that these thermometers will affect your pineal body. This is one of the QAnon fake news things they're pushing around. This thermometer does not emit laser rays. It picks up the heat of my body, the infrared heat, and it's able to convert that electronically. Gone are the days when we have these mercury thermometers you put under your tongue. And with the advent of various infections like HIV, we had to phase those out, because no matter how much you shake it out in a glass of Clorox or another thing and disinfectant, it's hard to use again. So these, it's a great invention, these electronic thermometers. They're not 100% as accurate as the mercury thermometers, but they're good. And they could be done safely, and anybody can use it. You don't need a nurse to use this. A teacher, a parent can use this. And if I press this, you don't see no laser. Now, there are some models that will shine a light, but that's not a laser light. And there's this fake news going around that's going to affect your pineal body. That's a little gland that's underneath your brain. It's fake news. Just like wearing a mask is gonna knock you out and you breathe in the carbon dioxide. These anti-vaxxers, these QAnon people and so forth, and they have a few of them here in St. Vincent too. I've got to tell you that. Big in Germany, big in Australia, big in America, and they just having a good laugh at us. These thermometers, I'm pressing it, I'm not seeing no laser beam coming on your forehead, and our kids are not gonna have that. I met someone today where something's been circulated to parents. Don't let them take temperature of your kids because it affect the pineal gland. It is fake news and it is wrong. I'm really upset about this sort of thing, because by detecting the temperature, we could pick up a child who has a temperature early, and by the next day, we see the temperature a little higher, and we could do something about it before it reaches up to 105, 106. And so I'm asking everybody, let's finish with all this fake news. Let's reject it. And let's see how we can keep St. Vincent and Grenadines as healthy as possible.
Well, that's a perfect note on which to end today's edition of Roundtable Talk. Thank you very much, Dr. Jerrol Thompson, as always, for your expertise. Tamara, Bobb, and of course, Shanika John. Thank you for coming along. And my advice, my tip to you, tip and toss. Let's keep St. Vincent and the Grenadines safe. Have a pleasant evening. My name is Teresa Daniel.